Hi there, I'm Lily. Welcome to the Vital Horse podcast. I'm a veterinary surgeon passionate about what our animals' behaviour can alert us to. I focus on nurturing the innate nature of animals to address the deep roots of health, well-being and vitality. Our relationship with our horses is an inextricable part of this. I am guided by what they show me. Many people say, if only they could talk, but they can tell us so much and we can communicate back. This podcast is about you being able to help your horse fully by finding out what's going on, deciding how best to help, and then doing this ethically and effectively. In this way, we can investigate and treat behavioural signs and underlying health problems, pain, or dysfunction in our horses while actually improving our relationship with them. Let's find out how. In this episode, I talk about needle shyness. The reason why I have chosen this subject for only the third episode is because of my online course on needle shyness, which actually started on the 1st of January, so it's already kicked off with the release of the first course content. However, if anybody still wants to sign up, there is still time without missing any of the live support, and you do have lifetime access to the course materials. So I thought I would introduce the needle shyness bit now, in case anybody does have a needle shy horse, or knows of anybody with a needle shy horse and really needs the help. So the first live support, if you're listening to this just after this podcast episode has been released, the first live support in 2025 starts on the 11th of January with a live Zoom call, and there will be access to the recording within the course member area as well. And you can get lots more live support from me. There'll be some information on that at the end of this podcast episode. So this episode is actually adapted from a free webinar that I have made on needle shyness in horses. And if you'd like to watch the webinar version, which has some photos and videos, which I am going to sometimes refer to in this episode because I've adapted the webinar recording for this subject, if you would like to see those, then you can go to my website, and it is nurturingnatureequine.co.uk, so .co.uk/needles-webinar, and that will take you to that 45-minute long free webinar, and you will be able to see the photos and the videos that I refer to in this podcast episode. Let's get started. Hi there, welcome to this webinar on needle shyness in horses. I've been a vet since 2016, and I've had several of my patients and also several of my own personal horses who have shown me that I really needed to do a deep dive into why horses become needle shy, why some horses find needles so extremely aversive. Needles are not something that anybody enjoys, but there seem to be some individuals who can cope with the discomfort and the procedure of having an injection or having blood taken, and there seem to be others who find it really, really unpleasant and they get very fearful. And then there are others who have had previous bad experiences and may even have some trauma associated with the use of needles. So I have really, in this journey, gone very deep into the underlying causes, and it's led me off down a lot of other rabbit holes, to be honest, which have all been very helpful for both my patients and my own horses. And I've come up with ways of helping horses to understand the process, find it less fearful, find it less painful, and also to be able to tell us whether they're happy to proceed with the process or whether they would rather we stopped or we paused, and that builds a huge amount of trust. So I'm going to explain all of that in this webinar and also give you some useful tips if you have a vet visit coming up, for example. They may well help you in an effective and a compassionate and ethical way. So this is not about catching them out or escalating any kind of physical restraint. Occasionally, or in some cases, it may be necessary to use some chemical restraint, so that is sedation. That doesn't sound like a very nice term, chemical restraint, but that is effectively what it is. Uh, if, in my view, if there is some degree of anti-anxiety effect to it, so that's called anxiolytic effect, it helps them with anxiety, and it also can help them with pain. There may be some pain relief in there and muscle relaxation properties. Then some sedation can be helpful for some horses, obviously orally, not by injection if they're already really worried about needles. Sometimes that can help the process. So that can be part of it for certain individual horses. I'm not going to go into that in a lot of depth in this particular webinar. I go into it in a huge amount of detail in my needle shyness online course. In this webinar, I'm going to be going through the underlying causes, how we can maybe start to tease those apart in an individual horse, how to help on the day, but there will be some horses that need a lot more than some of the sort of tips that I give you for helping on the day. And then I will give you a bit of a preview of some of the cooperative care approaches that are possible to train your horse. And those I coach in my needle shyness online course. So first of all, what is needle shyness? And to me, there is a spectrum. So some horses are actually phobic. Their reactions are very extreme, and that is because their emotions about it are very extreme. Some horses seem to want to jump or crawl out of their own skin in the presence of a needle, or even sometimes just in the presence of a vet. I've known some horses when my car arrived at the yard that is when the signs started, and they really can't cope with being there. They want the ground to swallow them up. They just do not want to be there. The spectrum can go all the way from this, and where it's dangerous or it's actually impossible to inject them, to a struggle and very stressful for all involved. So the horse, the handler, or the owner, that would usually be, and the vet or a vet nurse as well. But it may be possible to inject them, but it's very stressful and it's a struggle and it's not very safe, really. And it's getting worse every time because they're having a bad experience every time. It can be that they're quite easy to inject, but they really don't seem very happy about it. So you can see the difference between these two photos here. The one on the left was a much more extreme reaction with rearing and striking with the front legs and biting. The one on the right, this horse is actually standing still for me to use a needle, but his facial expression is showing signs of worry. Now, he actually, this is my own personal horse, dear old Peps, who I managed to have a dialogue with him over it where he actually needed regular blood tests in his later life. And we actually got to a stage where the two-way conversation meant that I could even take his blood samples at liberty. So I wouldn't necessarily recommend doing that, but I had done so much preparation and knew him so well and it was part of the process as well, as in he knew that he had the option to leave, but he chose not to because he felt safe and we were having a conversation about it. But it might be that your horse stands stock still, but they don't breathe, they don't blink, their jaw is clenched, and they're really not very happy about it. Now, that might be what some horses just need to do to cope to get through having an injection. I know that I might be a bit like that if I had a needle. But there may be some relationship repair that is needed after you use a needle in those cases. So at the time, it's not a problem, but afterwards, it would be nice to be able to conduct some relationship repair. And you might even find that maybe your horse doesn't want to be caught the day after, say, for example, their vaccination or something, or they've had to have a sedation for the dentist or similar, or a blood test taken, or that they don't particularly want to put the head collar on, or they're a bit sort of, oh, please don't pick me if you are doing a session with them. So in that case, I would for because my focus is heavily on having a good relationship with our horses, that I would want to address that even if it was easy to inject them. Different horses seem to have different levels of discomfort around discomfort. So some horses, when they experience something uncomfortable, they they jump out of their skin. They can't cope with it at all. And other horses can sort of grit their teeth and bear it. The entire spectrum is welcomed for help with needle shyness, and certainly on my online course we cover the entire spectrum. One of the reasons why this is important is, don't assume that a horse is just in one of these categories. So that works both ways. We can help horses who have a phobia. It depends. We may not get to the stage of Liberty blood draws. That might be a little bit unrealistic, but not necessarily. I again don't assume. But we can certainly help a horse with phobia to feel less terrified. But the other direction also applies. So if you have a horse that is currently okay about needles, or you can just about get it done, or you can get it done but they're a bit upset about it, again, it's worth addressing this, because it may be that they flip or they slide gradually into one of the more extreme categories of struggle and stressful, but still able to inject, or going all the way to impossible or really, really dangerous and really unpleasant. Now, I will go through in the online course more in depth than right now. I will go through what you can do if it is an urgent or emergency situation, where we can still be as compassionate and ethical as we can possibly be, and not sort of truss horses up with physical restraint as much as possible. When they really do not want to participate, and we kind of have to say to them, I'm sorry, but we really do need to help you out right now. You know, you've cut yourself or something like that, or we really need to get a great big piece of stick out of your eye, and or something like that. And so it needs to be done now. We can't leave it for another day. And so I will go into that more in the online course. But really today in this webinar, I'm going to be presenting how we can honour this response of, I am really not happy about this, and we can listen to that, but we can present it to them. How about in this way? And achieve some willing participation. So why would there be any difficulty with needles? Not that this is, it's not particularly surprising, because having an injection or a blood sample, having a needle inserted, is not pleasant, really, ever. There are worse examples. So one thing actually is just you really don't need to use a really huge needle unless you're injecting something very, very thick. So there are some ways of reducing the pain involved in needles. Sometimes vets will use an enormous needle, and it's not actually needed. So that's something to just be aware of. But here are the things really that are underlying needle shyness. So of course it's painful to have a needle inserted into through the skin, into the muscle, into a vein, into a joint, certainly next to a nerve. Can be very, very painful. Fear, and that can be associated with pain. It can also be associated with a previous bad experience, which might have been a amalgam of all sorts of things. So some horses find the physical restraint for a needle very, very difficult. I have known sometimes some tactics involving cornering horses, lots of ropes, some physical barriers that are very, very difficult for a horse to fight against. And all of those are bad news in terms of, well, both at the time, and they can really hurt themselves and scare themselves. And also, of course, for the next visit, you are not setting them up well for another needle by approaching it in that kind of way. And that can lead to actual trauma. And sometimes it's just that the foundations are really shaky, so they're actually not really very happy with being handled at all. If your horse is difficult to catch, that's your first clue. Probably adding a needle is rather advanced. So these two photos, the first one on the left shows some signs actually that Bo would rather not have the head collar on. He's leaning away, his eye and his ear are sort of cocked towards it, and he's got a tight mouth, and he's actually slightly clamping his jaw. It was easier to see at the time. So if you haven't sort of worked through being happy to put the head collar on, and then you go ahead and stick a needle in, then it's likely that they will be worried about that, or at least not very happy about it. The photo on the right actually shows a significant muscle scar from previous vaccinations. You can see it. We'd rubbed some cream into it there, and so you can see that is the size of the scar, and it's pretty deep. And injecting into a scar can be very painful. And I will go into this in a bit more detail. There's a lot more pain aspects to needle shyness. We could ask, why is it even a problem? Maybe we just avoid needles entirely, but that precludes some quite important things. So the first thing is preventative medical care, so such as vaccinations. Now, we do discuss this a lot in the online course because there is an argument for sure that some horses may be over vaccinated, and so we may be able to reduce our vaccine use. And that's quite important with certain types of vaccines and how they might have secondary effects and whether they're even needed for the epidemiology of the diseases that we're vaccinating for. But there are definitely some vaccines that are a total no-brainer. So the photo on the right here shows a donkey with tetanus. And tetanus is an awful disease. The vaccine's very safe. And it's very, very difficult to treat tetanus if an equid catches it. So I think that the argument of just not vaccinating a needle shy horse doesn't really hold up. I think we at least need the option, and we really should be able to vaccinate them against some core diseases. But yeah, certainly in the online course, we go into some more detail on, in your individual case, how can we make it so that we maybe are minimizing our needle use, especially if they're really phobic. We don't want to do it too often. The second really important thing, though, with having the option of using needles is being able to treat our horse in an emergency. So that includes giving them medications intravenously, for example, in cases of colic, and really importantly, that includes pain relief and also sedating them. So, for example, if they've got a huge wound and they need it stitching up, then sedating them intravenously is usually needed. The other thing, which is a really sad prospect, but is part of our responsibility as horse owners and veterinary professionals, is when it comes to end of life decisions. And if we don't have the option of using a needle for euthanasia, then we do still have the option of a firearm, but owner preference, a particular situation that the horse is in, safety considerations in the surrounding areas and things, we really need to have the option, in my view, of using a needle and a lethal injection rather than just the use of a firearm for that. The other things that sort of stem or branch off rather from this problem, well, they're actually at the root of this problem, but this problem is an indicator of problems with these things, are things that affect how we deal with our horses day to day and how we do fun things with them and how we do other husbandry procedures with them as well. So that includes relationship with pressure, relationship with restraint, which goes hand in hand with pressure as well, usually, and our relationship in general. So how does our horse feel about being around us, being touched, having headgear on, being asked to stand still, all of those kinds of things. So we want to explain these things to horses and have them be a willing participant if we want to have a good relationship with our horses, we don't well, I would hope we don't want them to be a slave to our wishes. And the last things really are just, it's a real safety problem on all sorts of levels. I've already been through possibly catching a disease that is preventable by vaccination, not being able to treat effectively in an emergency, and then also the safety of a horse trying to flatten you when they don't want a needle or trying to bite you or something. And the last thing that is a real practical consideration is the cost of wasted vets visits. If you have a call out for their annual vaccinations or the dentist or something like that, you will probably have to pay the call out fee at least, and maybe the vet has not been able to get near them with a needle and complete the procedure. So, what is cooperative care? This is the approach that I take along with removing other underlying causes. So the two-pronged approach is to look to the deep-rooted causes of needle shyness in that particular horse's case, and try to improve or remove those deep-rooted causes as far as we can. And the other prong is to train them cooperative care procedures. And this is where we prepare them for procedures. And the way that I have learned and developed is where they can cue you. So you have a two-way communication, and that builds a huge amount of confidence and trust. And really amazingly, allows them to feel happy with saying yes to you doing things that they really wouldn't otherwise. So this applies to needles. It can also apply to all sorts of other veterinary procedures, such as applying eye medications, maybe handling their ears, cleaning wounds, using a hose pipe, that kind of thing, and other husbandry procedures like handling feet, grooming if they're not particularly keen on certain parts of their body being touched, giving oral medications like worming, for example. So cooperative care is not really used that much in the horse world, to be honest, which is, well, we should remedy this. It's used a lot in zoo settings nowadays, a lot more so than actually in domestic species, I think. So the thing that cooperative care really does is that it prepares the animal or the horse for the whole sequence of events that are going to happen. So it's a predictable sequence of events. We're not sneaking up on them. They know what's coming. It partly, this is actually really helpful for us to identify at which point the problem lies. So is it actually the needle, or is it maybe even just standing on that side of their neck? It could be that, and all sorts of points along the process. We can train it at liberty, which is really, really valuable, because then we have true feedback on whether they are actually happy to stay with us for it or they would prefer to leave. Or we can actually train in protected contact. So they're on the other side of a barrier, and that can be very helpful if they display signs of aggression when they're worried, or if they have been restrained excessively in the past, and then if they're in protected contact and they're at liberty, they understand that they can leave and we actually can't come after them. We can train start buttons, so that's where they do a behavior to cue us to go ahead. We can train anchor behaviors, which is where they're actively continuing with the behavior while we go ahead, and if they interrupt it, then that's when we pause or stop. And then end signals that go with start buttons, that where they can actually cue us to please pause or stop. So that gives the horse choice and a voice in the process. And it's shown in people that, if you go to have a shot or something and you have someone who you say, oh, can you just give me a minute? And they say, nope, I'm carrying on. Then that's actually quite terrifying if you have a phobia of needles. But if you say, oh, can you just give me a moment? I just need to gather myself together a bit. And they say, yeah, that's fine. Take all the time you need. Let me know when you're ready. And then you think, oh my goodness, yeah, okay, I'm ready now. So choice and a voice build trust, and they really reduce fear. They also reduce pain, because pain is an emotional experience. And of course, they will reduce the fear of pain along with this. So delving deeper into the deep rooted causes of needle shyness, this is a little bit of a false separation, but we can think about it in terms of physical, cognitive, and emotional factors. It's false because they are all inextricably intertwined. But really, we can break it down to pain, a lack of understanding of what on earth is going on with the procedure, fear, fear of upcoming pain, and then we get to emotional states that are really not conducive to learning, and they go into their survival nervous system, and all reason and responsiveness, as opposed to just reactivity, go out the window. And that's panic and rage. If we get to immobility or collapse, then we are likely to end up with trauma. The next time around, they will then probably be worse. So, what can we do about these deep underlying causes? I have identified 4 deep roots to good health and well-being. That's physical, cognitive, emotional, social, all sorts. And these 4 deep roots I call husbandry for happiness. So that's having a lifestyle that meets your needs, and that is species specific. Movement medicine, and that's both being able to stand and rest in a healthy posture and to move around in a healthy way and to have enough movement and choice over it. So partly that's a lifestyle thing, partly that is postural and relates to their dental balance, their foot balance. It might relate to saddle fit, the way that they're trained, the way that they're ridden, the kind of discipline that they work in, all of those kinds of things. And any underlying genetic and other conditions, health conditions that they might already have. The third is cultivating comfort, and that refers to pain in the more physical sense, but also discomfort or unease psychologically or emotionally. And then the fourth is communication, compassion, and consent, and that is where horses in relationship with us are able to communicate. We are clear and consistent in our communication with them, and we know that that's important, and that there is compassion when it comes to if things are not really going to plan, or if they are, then we approach that with compassion as opposed to reactivity on our part. And that means that there can be something approaching consent, which may or may not, we can debate whether that's the right word, but horses can willingly participate in what we're doing with them. So I exclusively want to use techniques that do not rely on learned helplessness, where a coercive training technique has been used and the horse is maybe better. So maybe they sort of submit to the process, but that's because they've learned that that's all they can do. So I am not into that. I'm using techniques that don't rely on that. So, for example, on the learned helplessness front, why is escalating restraint unhelpful? And this restraint might include physically holding, coercive training techniques. So, for example, this is where the phrase "make the right thing easy and the wrong thing hard" can really go a bit overboard, where they have no choice basically in the process, and that can lead to learned helplessness. For needles, often the use of a twitch might have been employed, and any type. So a lip twitch is the only one that truly releases endorphins. An ear twitch is just a crude way of holding on to them. A skin twitch might be giving some different skin stimulation, but again, or some actual pinching pain, but it's not releasing any endorphins. But I don't endorse the use of a lip twitch either, because horses are not improved the next time by the use of a twitch. So ideally, I mean, maybe in extremis, in an emergency situation, you might be forced to use a lip twitch. I would rather not. And it might include sedation. And importantly, some forms of sedation that have no anxiolytic effect or muscle relaxation effect, they just immobilize the horse. That leads to the things that are crossed out in red here: panic, rage, possibly immobility, possibly collapse, and therefore trauma. And so the next time you come to use a needle, the horse will be even less keen on the idea. So, what can we do about it? And the things that we really need to do are address these things in green. So we address pain and fear, provide an understanding of the process, create a feeling of safety, and at the time, so when we're preparing, we need to do all these things, but then at the time when it comes to it and we put all of our preparation into action, we still need to observe their thresholds to avoid the things in red happening, and actually to also avoid the things in green happening. That's important because we can sometimes train a cooperative care behaviour and then we think we're done and dusted, and then we go through it and it actually can turn into being coercive. So we need to remain cognizant of their natural signs to us that they may be becoming worried. So addressing pain and fear. I'll just run through some of these things to give you a better idea, and these might help you if you have an upcoming vet visit. So one really simple thing with addressing the pain of an intramuscular injection is just have relaxed muscle to inject into. So be aware of the horse's head position. A lower head position, sort of head at about approximately with a height, is usually helpful for an intramuscular injection. If they throw their head up and their neck goes rock hard, it is likely to be quite painful to introduce a needle. Some other things that will address pain and fear immediately at the time of the appointment. A familiar location and routine. So don't change your horse's routine all at once when the vet comes and bring them to a totally different location. Do it where they are comfortable. Quiet, peaceful atmosphere. Give yourself plenty of time so you're not running around going to catch them just before or maybe after the vet's arrived. Have a horsey friend with them, a buddy that they feel safe with, not a horse that bullies them, but a buddy that they take confidence from and who is calm at the time of the process, not one who's hypervigilant and on alert. You can definitely use distraction with food if they want to eat. If they're really fearful, they will probably not want to eat. But that also has a counter conditioning effect. So you turn something that is unpleasant into something a bit more pleasant. It will probably not help in really extreme cases, but definitely use it if they are interested in eating. Scratching or tapping the skin somewhere distant to the injection site can sometimes help as an alternative sensory stimulus and can help them to not notice the needle quite so much. If they're really extreme, that probably won't help. You can apply some cold to the injection site beforehand. Sometimes that really helps some horses with the pain and discomfort of a needle. For an intravenous needle, so maybe an IV sedation or a blood draw, you can apply local anaesthetic cream to the skin beforehand. You do need to clip the hair off and put some cling film over it and bandage it ideally, and do it about 25 to 40 minutes before the needle's going to go in for that to be really effective. That can really help with the discomfort of an intravenous needle. Head position again, so relaxed neck muscles. On the right, you can see the sort of head position that relaxes the neck muscles for an intramuscular injection. On the left, you can see the kind of head position that is needed to be able to easily find the vein for hopefully a smooth one needle in for an intravenous, not digging around trying to find the vein. Emotionally charged stimuli, so something that they find really worrying or they think is going to be painful, can capture all their attention and heighten their sensation and make things genuinely more painful. So these things might not be enough if they are really severe. And that's where the more detailed stuff in my Needle Shyness online course can really help you. So here is a list, which I'm not going to go into in detail, but a list of some examples of what actually might make needles incredibly painful for your horse. Hypertonic muscles from standing in an abnormal posture, and that might be related to an underlying condition. You may even be doing a lameness hunt, and your needle shyness may even help you to determine where your horse is unsound. I mentioned injection site scars before. There's also a phenomenon called central sensitization, where if they have grumbling pain or some other kind of pain in their body, it can sensitize the nervous system, and then things that would normally be very mildly painful or not painful at all can become excruciating. Foot imbalances, dental imbalances, posture can all lead to really sore points on their body, and then you might be trying to put a needle into a sore point. Same with nerve impingement, which is a very big subject, and that goes with posture and all sorts of other unsoundness conditions. Fascial tension, there's lots and lots of nerves in fascia, and trying to inject into something very tight is likely to be painful. And also, skin conditions or hypersensitivity reactions can make it really unpleasant as well. So, as part of removing or alleviating the underlying causes, we would address these things and not necessarily even look at the needle process, but address these things in helping them. In providing understanding, we need to be able to have a predictable process. And so they know what's coming and they can opt in or out, ideally, unless it's an emergency, as I've already mentioned. And these two photos are an example of some of the cooperative care things that we would train. The scenario on the left is for intravenous needle use, and the scenario on the right is for intramuscular. And I go into that in lots of detail and coach you through how to build those in my online course. Another aspect of providing understanding is just to have some prerequisites in place, some foundations in place to be able to use a needle with some willing participation at all without even starting the needle process. So I've mentioned this a bit before, but the list is happy to be caught, happy to wear their head collar or halter, whatever, happy to be led, stood next to in the site where they're going to have a needle, touched with just your hand at those injection sites, happy to have the vein raised before an intravenous injection, and then happy to have all of this done in the presence of a second person and ultimately a stranger, and ultimately by a stranger. So be touched by a stranger. If they're not already happy with that, they are going to have a problem with a needle going in. And also where needles don't cause excruciating pain, fear and fear of pain. So addressing those underlying causes of them being very painful. In providing understanding in a cooperative care context, there are the start buttons, anchor behaviours and end signals that I've already talked about. And then there's also teaching relaxation of certain muscle groups for intravenous injections. So there's lots of options for a cooperative care approach. We build a behaviour where a behaviour from them instigates a behaviour from us, creating a feeling of safety. Now, this is a huge subject because this is to do with your relationship in general, but it can also be to do with being able to give you an end signal. End signals can be formal, in quotation marks, in that you have built them in some form of training context and they become a way of your horse communicating something specific to you. Or they can be what I call informal, in that they just consist of the natural signs your horse already displays in their facial expressions, body posture, behavioral responses, etc., that allow you to notice they would rather not proceed right now. So these informal, non-trained or non-captured end signals are still important to notice, even if you're using trained ones. So this means observing thresholds at the time. So this is an example of my dear old Peps having his blood draw at Liberty, and we have a little conversation where I pause when he raises his head. Then he gives a blink and stands still, and another blink, and that has been our conversation of he's okay with me to proceed. If we need to, we may need to go ahead with needles before they're fully prepared, and in which case we may not be able to give them the opportunity to ask us to pause and stop, or we might have prepared loads and then it doesn't really go to plan on the day. So for that, we need to be able to forgive ourselves for that situation and whoever else was involved. And we also need to engage in some relationship repair. So we probably can't really expect to get to a stage where the horse is really happy about having needles, because who really likes injections. And cooperation might be a better term than true consent. But we can certainly help with the stress and the pain involved. But sometimes repair might be needed. So just spending time, make sure that you spend quality time with your horse as well as training time, and focus on your relationship as well as the things that you really need to get done. So my online course starts, this particular running of the online course starts on the 1st of January 2025. It runs for 12 weeks. You get lots of time with me during that live sign up time. You do have lifetime access to all of the course materials. So if you can't make some of the live things, and they will be recorded, then it's still very valuable. So we cover all sorts of things in more detail than I have in this webinar. Mindset and the human factor, preparing your horse, and a good environment for things to go well. A really deep dive into those root causes, so physical, cognitive, and emotional reasons for needle shyness. The uses of needles and possible alternatives. So this might even include alternatives to a diagnostic workup process that has been proposed for a particular horse, or or for example, vaccines. Then we look at foundations for non-traumatic needle use, and this can include preparing young horses or horses that have already had a bad experience. We look at the cooperative care behaviours and building them, and I coach you through that. Importantly, we look at restraint and pressure as well, and some troubleshooting for building the behaviours, and then what to do in urgent and emergency situations. There's lots of resources included. There's over 30 lessons in webinar and video format. There's 3 live Zoom calls, which are also recorded. You have access to those recordings and all recordings from all previous runnings of the needle shyness course, if someone's asked a question at some point that is really useful for you. You can also book a 30-minute one-to-one call with me, so that might help you to with some real in-depth coaching of the cooperative care behaviours, or maybe to dive deeper into your horse's unique causes for needle shyness. You can submit videos as well for feedback if you're building behaviours or observing things about your horse that might give you clues as to the underlying causes. There are downloadable worksheets to help you. You can take them with you to the barn to help you with step-by-step guides to things. There's a private Facebook discussion group, which is got lots of like-minded people on there, and lots of similar stories. And I'm also giving bonus access to a webinar on my approach called Attuned Assessment, which is where we actually use this two-way communication to let the horse tell us how they feel and where they might be in pain. So it helps us with a diagnostic process. This course really is for anyone who wants to prepare their horse for injections in a way that really honours their feelings. Anyone who wants to deeply consider all aspects of the underlying causes for needle shyness. You don't have to go through all of the lessons, because there might be certain things that are more relevant to you, but they will help you uncover the causes in your unique case. Any horse, no matter how bad or good they currently are, whether they've never had a needle before, they're maybe a young horse and you just want to prepare them well, or whether they are very, very scared of needles and they've had bad experiences, and everything in between. If you've tried a quick fix and it hasn't worked, or it has actually made the problem worse, then this is definitely for you. To take part, you will need access to a device on which you can watch the videos and an internet connection for the Zoom calls. It's helpful to have either a helper to video you, or a grippy phone tripod on a fence post, or if you get fancy, maybe a Pivo or something to record some video of you for some feedback and guidance on the behaviours. If you're going to do the cooperative care stuff, then there's various things like cones. A target can be useful. If you want to build an end signal, then a bell is very cute. Mats can be helpful, and to make some sort of a chin rest, and I can give you guidance on that when you join the course. A pencil, some brushes, paint brushes and things for introducing novel sensation, and a well-fitting head collar or halter and rope, but mostly it's just you and your needle shy horse. So to sign up, go to www.nurturingnatureequine.co.uk/needles. Hope to see you there. Thanks for listening to the Vital Horse podcast, where you can find discussions focused on helping horses in ways that combine scientific principles and evidence with compassion and understanding. Do subscribe if this content has rung true for you. To work with me in a way that honours both head and heart, check out my online and in-person offerings at www.nurturingnatureequine.co.uk. If you are facing problems or are trying to answer questions with your horse, remember that physical, mental and emotional well-being are inextricably interconnected, that there is a wisdom to nature and to the body that we can assist, and that cultivating meaningful relationships with our animal companions holds an important key to the well-being of all of us. Deep awareness and a compassionate process will enable us to find sustainable, ethical solutions. See you for the next episode and look forward to working with you too.